What will not go away while the president is on vacation is the health care debate. Howard Dean is the former head of the Democratic Party, a former governor, and a medical doctor. I spoke with him earlier today about his prescription for national health care reform. There has been a lot of piecemeal health care legislation passed over the years, but how optimistic are you, first of all, that we're going to see a comprehensive health care bill passed in this session of Congress?
I'm pretty optimistic. I think the president has staked his administration on it. I think Congress really wants to do it. This bill's already passed 4 out of the 5 committees that it has to pass. So I'm pretty optimistic that we will have real health care reform by the time we're done.
We're hearing the words public option a lot. For those Americans who still don't fully understand what that means, can you quickly give us a definition of public option?
Sure. It's very simple. It's the ability of Americans to choose between a private for-profit health insurer or a government public health insurance option like Medicare. It's essentially allowing people under 65 to buy into Medicare if they prefer not to be in the private health insurance market. And Medicare can't be taken away from you if you get sick, and it moves wherever you do, and it stays with you if you have a job or if you don't have a job. So there's a lot to recommend it.
The president has hinted that he may take the public option off the table if it means getting a bill passed or not. You are against that. Why?
Well, I think if you want real health care reform, you have to have a public option for the people to choose from. It gives people employment insurance even if they don't have employment. It cuts out a lot of the return on equity and the huge CEO salaries that you're paying for when you pay premiums to a private health insurer. But some people will prefer to stay in the insurance market, the private health insurance market, because they like their coverage, and that's fine too. That's the nice thing about the president's bill is you get to choose.
We have seen people across the country very angry at what they call a flawed government takeover of health care. They're concerned about the cost as well. In fact, if you look at the president's poll numbers, they have dropped as far as his handling of this health care issue has gone. What is your advice for the president?
Stick to it. People value strong leadership, and I still think Bill Clinton's got the best political mind in America. And he said a couple of times last weekend, once the president signs this bill, his numbers will go right back up again. The president set out to reform health care. I think he intends to finish the job, and I think he's just hoping the Republicans will help. But if they won't, we can do it ourselves.
Governor Howard Dean, thank you so much for joining us. We appreciate it.